Hello and welcome to our coronavirus question and answer segment where we answer your email questions. If you'd like to submit one, just go to newsanswers@cbn.org. Today, we're happy to be joined by neurologist David Perlmutter, an immune system expert and best-selling author whose latest release is Brainwash. Welcome, Dr. Perlmutter.
Delighted to spend time with you, Lori.
Before we get to the email questions, I wanted to touch on what you have recommended in previous interviews we've done with you, in which you suggest people eat lots of fruits and vegetables, but now sometimes we worry those foods might have the coronavirus on them, the so-called invisible enemy. What are your thoughts on that?
I think it's still very important, in fact, now more than ever, that we maintain the very best anti-inflammatory, immune-boosting diet that we can, and that is a diet that really does favor fruits and vegetables. So the point is certainly well taken, however, that when we go to a grocery store, we don't know if, in fact, there may be virus on the very foods that we are buying. So I recommend shopping with gloves when you bring your food home. I think it should be scrubbed in the sink with soap, and I think that should take care of things. We like to buy things that come wrapped because it's easier to sterilize things on the outside. But by all means, I don't think it's a good idea to take your fresh fruits and vegetables, bring them home, and immediately put them in the refrigerator with all the rest of your food. So a soap solution with warm water and a brush, I think, is a reasonable thing to do in terms of doing your best to, as it were, sterilize your fruits and vegetables. Some things lend themselves more easily than others, like cucumbers, tomatoes, apples, etc. We can scrub those easily with a brush. Lettuce and leafy greens is a little bit more challenging. But I think that, again, this is a worthwhile question because it really gets to the heart and soul about what makes for a very good diet as it relates to our immune systems.
We've been hearing lots of talk out of Washington, D.C. about ending isolation by letting young people go back to work. Why are older people in greater danger from this virus?
I think it really has to do with the ability of our immune systems to react appropriately and sequester and deal with this virus. We lose that ability as we get older, and certainly we know that that ability is also compromised when there are underlying health conditions like diabetes, lung disease, coronary artery disease, and even obesity. Having said that, however, it's certainly quite clear here in America, more than in other countries, that being young as it relates to your biological age and chronological age isn't necessarily 100% protective. We've seen plenty of cases of younger people having real issues and, in fact, succumbing to COVID-19, possibly because of the increased rates of underlying medical conditions that are so prevalent in the United States.
Tenafo wants to know what has provoked coronavirus.
Well, that's a very good question. We don't really know. We know that viruses do their best in terms of mutating so that they can be spread as far as they can be. It's difficult to grasp how that happens, but this is certainly nothing new as it relates to our experience as human beings with viruses. In my lifetime, we've seen this happen time and time again, whether it was swine flu, H1N1, we saw worsening cases of Zika virus and certainly Ebola virus. Why they suddenly take hold is certainly luck of the draw as it relates to viruses that basically experiment with any number of mutations. Once in a while, a particular combination of mutations makes them much more, unfortunately the term is virulent, in terms of both their ability to spread as well as their ability to wreak havoc with respect to human health.
All right, Mary wants to know, if a person had COVID-19 and has completely recovered, can this person get this same COVID-19 virus again?
That is an excellent question. We only have research done in macaque monkeys that would indicate that one experience with COVID-19 in particular is enough to impart immunity. So that study done in primates indicates that, in fact, getting it once would impart immunity. On the other side of the coin, however, we are seeing individuals who have had COVID-19 fully recovered, then develop issues again. Now, does it mean that they were reinfected, or does it mean that the virus reactivated itself within their bodies? We don't yet have the answer to that question, and we really need to have that answer. My sense is that by and large, people who do develop antibodies, the IgG and IgM antibodies against COVID-19, are virtually immune, meaning that perhaps there is a small chance that they could be infected again, but current guidance tells us that if they are reinfected, that the second time around, it won't be as severe as the first time around in terms of symptoms.
Frank asks, until a vaccine can be produced, would it be possible to make mask wearing mandatory for those returning to the work environment?
Well, it's certainly possible. Whether you can pull that off or not certainly is a different story. You know, that is certainly a governmental edict that would need to be issued. Whether that comes from Washington or is something that the states determine for themselves, we would have to see. My feeling is that masks are helpful and should be used. I think we've learned that from experiences around the world. We should learn from what other countries have done and the success that they have demonstrated. I think that mask wearing would allow a more rapid return to work and is something that should be considered mandatory, in my opinion, here in America.
Jeanette says, I heard the coronavirus does not infect the lungs, but the blood. Is this true?
The receptor for the coronavirus, the ACE2 receptor, is widely distributed in the lungs. That's where this virus binds and then makes its way into the cell. Oddly enough, the receptor, the ACE2 receptor, is also represented in the gastrointestinal system, which might well explain why, unlike the flu, there are a lot more people, although the percentage isn't great, with COVID-19 who have gastrointestinal issues like nausea, vomiting, and diarrhea. That said, we know then that the virus replicates in lung tissue and replicates in the gut as well, which explains why the two most important vectors for transmission of this virus are from breathing and things that come out of the lungs, as well as through the stool. We don't really talk about it much, but I think it's very important to understand that people shed the virus through their feces, and that, you know, what goes on in the bathroom, I think, is very important to talk about in terms of potentially representing a transmission vector.
All right, well, Dr. Perlmutter, thanks for putting that very delicately, as only you can. That's great information. And unfortunately, that's all the time we have for now. Our thanks to Dr. David Perlmutter. His website is drperlmutter.com. Dr. Perlmutter, great to see you again.
Good to see you too.